What is spirometry? Spirometry is a simple method of assessing lung function, and it is the most commonly used pulmonary function test. It is performed using handheld device called a spirometer or a larger tabletop device. The main function of spirometry is to measure the volume of air that the patient is able to expel from their lungs following maximum inspiration. This helps to differentiate normal lung function from obstructive and restrictive defects. To be clinical useful, spirometry test has to be performed to a higher standard. First, ask the patient to breathe in and deeply as possible. Next, ask the patient to hold their breath just long enough to seal their lips around the mouthpiece. Finally, ask the patient to blow the breath out forcibly as hard and as fast as possible until there is nothing left to expel. The patient with severe COPD can take up to 15 seconds, and it is important to encourage the patient to keep blowing out. What does spirometry measure? Spirometry records volumes against time. The essential measurements are forced expiratory volume in 1 second, or FEV1, and the forced vital capacity, or FVC. The patient starts with a full inspiration and breathe out as quickly as possible. The FEV1 is the volume of gas exhaled in 1 second by a forced expiration from a full inspiration. The FVC is the total volume of gas exhaled after full inspiration. Calculation. The ratio of FEV1 FVC is calculated and used to determine whether there is any evidence of restrictive or obstructive lung disease. Individual measurements of FEV1 and FVC need to be corrected for the patient's sex, ethnicity, height, and age. FEV1 and FVC are then expressed as a percentage of predicted for matched healthy individuals with no lung disease. Many spirometers calculated the FEV1 and FVC as a percentage of predicted. Ratio of FEV1 and FVC expressed as a percentage. A ratio of FEV1 FVC of 70% or above is considered normal, but the range of normality is considerable and varies with age. Are you ready? Okay, let's start now. More, sikit lagi. Alright. In the conclusion, as a result, we have identified our subject, which is Sheikh Fazrin, has been categorized in a moderate normal category. In this spirometry test, because of his ratio of FEV1, FVC is 64%, and shown that the subject lung have an obstructive pulmonary disease. Spirometry test is used to diagnose asthma, chronic obstructive pulmonary disease, COPD, and other conditions that affect breathing. If you have a trouble from breathing, this is the most suitable test to use in order to identify either your lungs and breathing are having a problem or not.